This is One-on-One. Hi, Steve Adubato here on the campus of NJIT. We just finished up a forum on the Affordable Care Act, the ACA, just a couple days before March 31st, where the first official enrollment period for the exchanges is supposed to be ending. So many questions. We had an expert panel. We have Darrell Terry from Newark, Beth, who's the Chief Operating Officer. Darrell, you were here. You heard some of the discussion. You guys at Newark, Beth, the leading healthcare providers here in the city, you heard the discussion, you heard the experts, you heard the folks here, but you're in the trenches every day. The ACA, people signing up, how are we doing?
We're doing okay, especially on the Medicaid portion of it.
Medicaid expansion.
Medicaid expansion, right. So one of the things I want to thank you for doing this. This is important, and it doesn't end on March 31st. The education piece has to continue throughout. People need to be educated and understand what's going on. So we have to keep the momentum going even after March 31st. I don't want people to just think that this is a drop-dead date, and it's really not. We need to continue to educate our customers and make sure that they are ready for when it opens back up again, and certainly enroll many people as we can in the Medicaid expansion. That's huge. And we've done a great job at Newark, Beth, converting charity care people to Medicaid, and really
explain how that works.
So we have financial counselors, and we work with charity care patients and turn them into Medicaid patients, and we actually pair them with a doctor. We want them to have a medical home, so we want them to have a primary care physician. We want, as you say, I'm going to my doctor, we want everybody to be able to say, I'm going to my doctor. So we really pumped up our primary care, and we're attaching primary care to these individuals to make sure that they have the same access to care that you and I have.
It's so interesting. We were talking about a lot of folks who may be saying to themselves, as we do this program a few days before March 31st, I'll just go to the emergency room, and Newark, Beth has one of the biggest and most active in the city and the state. Darrell, what do you say to those who say, hey, listen, I can get health care, I can get taken care of in the emergency room, so I don't really need to go to the exchange? What do you say to those folks?
It's not the best place to get your care. Of course, if it's an emergency, you need to go to the emergency room. But for primary care, you really need to attach yourself to a physician so he can get to know you, get to know your habits, get to know who you are, what you're about, so he can really help you, so he can get to the root of it. If you go to the emergency room, you're going to see a different physician probably every time you go there, and they will be able to treat whatever's going on that day, but they might not be able to get to the root of what's going on. You really need to connect with a primary care doctor.
Darrell, you know this community very well. Darrell works every day dealing in the city of Newark and the surrounding communities with his colleagues at Newark, Beth. It has been challenging. For those of us in public broadcasting, holding this forum tonight, trying to reach out for people, they're on the front lines every day of providing quality health care. But what is your sense as to why this has been so challenging for so many, just say in the city of Newark? Because there's so many people who are eligible to sign up, and it's been a challenge one at a time getting them on board. What is your sense as to what some of those challenges are?
Some of it, of course, is the politics of it, and there's a confusion with the rollout. It was the execution of it, but then there was a lot of...
The website didn't help.
They didn't help. It did not help, but the politics didn't help, and it's a lot of confusion, and we really just need to be out there educating people, getting them connected to healthcare, because at some point they're really going to have to look at the personal responsibility and how they can help themselves improve their health. And so I think that programs like this is very important to really get the word out, get the message out. We all have to be soldiers. We have to be foot soldiers and get the word out.
And finally, if I can ask you from a perspective of Newark, Beth, how do you see the hospital's role, the medical center's role in terms of providing health care in this community, and how does that change with the implementation of the Affordable Care Act?
Well, we really want to move away from emergency care inpatient care, episodic care, and move much towards wellness.
What does that actually mean? Give me an example of that.
So we want to teach people how to take care of themselves. We want them to eat right. We want them to exercise. We want them to, if they have chronic conditions, we want them to be compliant with the doctors, whatever they prescribe for the treatment. So we really want to keep people out of the hospital, which is a shift. We've always been fee for service, and we get paid when people come in for our services.
Doesn't work anymore.
So no, it doesn't. It doesn't, because we're not really providing health care. You know, what healthcare really is to make the communities that we serve healthier, and that's what our goal is, and that's what we're going to do.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, Berkeley College, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.